The new CDC internal report not only acknowledges that so-called breakthrough infections are rising, but that they may be as transmissible as unvaccinated cases.
Were you surprised that you had been vaccinated and got sick anyway?
Yes, absolutely.
Catherine Grigor in Florida is still in isolation after testing positive about a week ago. She was vaccinated back in March.
You can still contract the virus and you can still get sick, but you're not going to get as sick as you would if you hadn't. So I feel like I'm very fortunate.
The CDC stopped providing public information on total breakthrough infections in late April when the tally hit 10,000. Instead, it only posted data when they led to hospitalization or death. So NBC News reached out to all 50 states. 38 responded. We found more than 125,000 fully vaccinated Americans have tested positive for COVID. According to a CDC internal document, there are now roughly 35,000 breakthrough infections per week. Keep in mind, that's a tiny percentage of the more than 160 million fully vaccinated Americans.
If you are vaccinated, you have 25 times less chance of getting hospitalized or dying.
In Provincetown, Massachusetts, a COVID cluster of 882 cases is linked to the Delta variant. The CDC analyzed nearly 500 of those infections. About 3/4 of them were in people who had been fully vaccinated. Just 4 were hospitalized. In Los Angeles County, during the first 2 weeks of July, fully vaccinated people made up roughly 26% of all new infections. Martha McAdam, a kidney transplant recipient, was vaccinated in February but came down with COVID in March. She was hospitalized for 48 days.
If I hadn't had that vaccine, I wouldn't be alive today.
And that's why public health experts say the vaccine works despite breakthroughs. A Yale University study recently submitted for peer review estimates that here in New York City alone, the vaccine campaign has prevented 250,000 cases and 44,000 hospitalizations.
Hey, Aaron and Morgan. The Delta variant is driving new waves of infection right across Asia, including here in China. But few places are as bad off as Indonesia. 50,000 new cases every day, a mortality rate greater than any country in the world. And in recent weeks, hundreds of children have been dying from COVID. There are a lot of challenges in Indonesia, a low vaccination rate, not enough hospital beds, and now even the cemeteries are filling up too.
Day and night, they dig deep and bury fast, a grim ritual that plays out with painful regularity. From above, the grid of fresh graves on the outskirts of Jakarta is a chilling glimpse at the horrendous toll COVID is taking in Indonesia. The spread of the Delta variant is so indiscriminate now that Indonesia has become Asia's new COVID epicenter. And the demand for funerals is soaring. Coffins arrive, about 10 every hour, shrink-wrapped with plastic to protect the people handling them. It's a place where grieving families are rarely alone. It's not difficult to get a grave here, says Andreas Hutapea, who lost his mother. I actually believe and don't believe in COVID, he says, but what can I do? Indonesia is battling a COVID catastrophe that has pushed the healthcare system to the point of near collapse. Hospitals are so overstretched and overrun, they've set up beds for COVID patients outside in parking lots. Oxygen in such critically short supply that most families buy their own if they can find it. Inside hospitals, medical staff are vaccinated and wear protective gear, but it doesn't help the fatigue that comes with losing so many people.
When the patient comes in a severe condition, put dead and 1 hour and 2 hours he died, we will transfer it to the morgue, and then the new patient will come and put in the same bed.
Just one after another.
Come and go.
Even with the crisis, only a fraction of Indonesia's population has been vaccinated, just over 7% of 208 million eligible people. The government has been criticized for its slow rollout of vaccines, but religious social media influencers have also been spreading anti-vaccine messages across the internet. There's something else at play. Most of Indonesia's supply has been coming from China. The government ordered 125 million doses from Sinovac. Lately, there are questions about how effective Sinovac's vaccine is after reports some Indonesian healthcare workers who were vaccinated with it got infected with COVID and some died. The big concern that Indonesia's crisis could unleash a new COVID variant before enough people are vaccinated. For now, there's a steady stream of ambulances pulling up to identical rows of plots, both fresh and filled. Of the 5 sprawling sites like this for Jakarta's COVID dead, already 4 of them are full.
On vaccines, and in particular the Chinese vaccines, experts say there's a lot to consider. The Delta variant is that much more infectious, and there is no vaccine that's 100% effective. So booster shots are part of the bigger plan in most countries in Asia, but right now most countries are a long way off from having enough people get even one shot.
COVID-19 is causing an increasing number of deaths in Africa, with health authorities unable to contain its spread. The World Health Organization says the Delta variant of the virus is to blame, particularly in South Africa, which has lost 67,000 people. That's 40% of all pandemic deaths on the continent. The sheer numbers are putting South Africa's healthcare system under severe stress, as DW's Christine Mundwa reports from Johannesburg.
The graves are still fresh. People laid to rest here have not been gone long. The third wave of COVID-19 in South Africa has been the grim reaper the country was not ready for.
All of the graves here, and there are hundreds of them, were dug in the last few weeks, really, in the months of June and July. Most of the people buried here are victims of COVID-19.
The managers of this burial estate say they've been conducting up to 10 funerals a day. At this dialysis clinic in the western part of Johannesburg, the beds in this ward are unusually empty.
This is a busy center. We close around 7 to 8, but of late we are now closing at 2 because a lot of people really did succumb to the virus. Unfortunately, because our patients are immunocompromised, we lost quite a lot of them. When you look around, you realize, wow, so many people are gone.
South Africa's healthcare system has been overwhelmed as the Delta variant, first detected in India, has dominated new infections here. Many sick people have been turned away from hospitals.
A lot of hospitals were struggling, so we ended up getting calls as a dialysis center, which is not actually supposed to deal with COVID people, getting calls from people all over Johannesburg asking us to assist with oxygen, including our own patients. So we tried to assist those that we could, but we literally couldn't assist everybody. So what we did then is that we're giving oxygen to those who are literally gasping for air.
Frontline healthcare workers have not been spared. Dr. Lungani Gwala works at a public psychiatry hospital. She's just recovered from COVID-19, but some of her peers have not been as lucky.
A lot of healthcare workers have passed on. A lot have needed long-term hospitalizations. You know, I myself contracted COVID at some point. Luckily, mine was not so severe. You know, I was able to take out my symptoms at home, but not everyone is as lucky. The third wave came and it was a proper wave. It was just like a tsunami wave.
The third wave has been South Africa's darkest hour yet in the coronavirus pandemic. It's forced the government to close schools, ban all public gatherings, and prohibit the sale of alcohol. And in a country with so much poverty already, the measures are having a devastating economic impact.
for Missourians to get vaccinated, quote, as a way of following Jesus' command to love your neighbor as yourself. The idea was spearheaded by a Christian magazine in the state of Missouri. Let's bring in director of the Center for Infectious Disease Research and Policy and a professor in the medical school at the University of Minnesota, Dr. Michael Osterholm. Dr. Osterholm, it's good to see you this morning. We'll get into the particulars of where we are in this country right now, but I'm curious what you think about the importance of these kind of what's being, trusted partners, as they're called, inside these communities, inside Christian communities. Someone as prominent as Mitch McConnell or Steve Scalise, who's been hedging about whether or not he thinks people should get vaccinated, not just getting vaccinated, but posting a photograph of himself getting vaccinated, perhaps a statement of how serious things are getting across the country.
Well, let me just put one number out to begin the discussion with, which I think should be our focus. 100 million. There are 100 million Americans right now who are not vaccinated or who have not had COVID yet and developed their own immunity. Some of these are obviously kids that can't be vaccinated yet, but it gives you an idea just how many people left for this virus to infect. So we need all the help we can get. Right now, we really have three different groups of people in this country with regard to vaccine. The vaccine affirmative, people like myself who couldn't wait to get the vaccine. Then we have the vaccine hesitant, people who really are thinking about it, they want to get it, but they still have concerns about its safety. And then there's the vaccine hostile. I'm not sure we're going to change that vaccine hostile, but I think there are a lot of vaccine hesitant people right now that we could move. And the leadership of the Republican Party, of certain kind of media venues that can help come forward, we can only do nothing but help us with that vaccine hesitant group.
Dr. Osterholm, you've always been incredibly straight and blunt with us over the last year and a half as we've walked through this pandemic together. So in your estimation, where are we right now?
Well, we clearly are in an area of uncertainty, but I would like to, I think, add a context to a lot of the comments. People are worried about, we got to get vaccinated now for the fall. You know, I don't know that the fall is going to be it. I think it could be right now. For the first time in the pandemic, we're seeing cases increase substantially in all 50 states. Surely less in the Midwest and the upper Northeast, but we're actually seeing right now 42 states that have had over 100% increase in cases in the last 2 weeks. This variant is a bad, bad virus. It's 1,000 times more virus produced when someone who is infected. It clearly is much more infectious than the previous strains, and it's a virus that will find you if you're not vaccinated. Well, we have to tell people you can't, wait out the clock on this one. This is not one that, one day I can say, well, I avoided it. This virus will eventually find you. You have a choice. Either get vaccinated and be largely protected, or not get vaccinated and run the risk of being hospitalized in intensive care or even dying. And even last but not least, because we can't vaccinate our kids right now, you want to bubble those kids as much as you can. Don't bring the virus home and infect one of your kids. I actually know of personal experiences where adults have brought the viruses home, their kids have gotten infected, and they become seriously ill. You don't want that to happen. Get vaccinated.
Dr. Osterholm, Mike Barnacle has a question for you. Mike?
So, Doctor, we are now, as you just artfully described, dealing with the Delta variant. The globe is dealing with the Delta variant. My question to you might be unanswerable, but are these variants going to exist for years and years? Are we going to be dealing with potential vaccinations for these variants 4 or 5 years from now?
This virus is here to stay, Mike. It's not going to go away. Our job is to control it the best we can. And, I know that people are concerned about variant development here in the United States among the unvaccinated, but let's just put that into context. There are 6.4 billion people that live in low and middle income countries that have virtually no access to the vaccine at all. Right now, we are seeing this virus ravage around the world. And every time that we see one of these horrible situations, obviously we think about the number of people ill and dying. I also think about the number of new variants that are spinning out of that very situation. So you're right, Delta is the worst we've seen so far, but it hardly means that it's the last one we're going to see. So I think that this is our challenge, and why with the vaccines, as many people as we can get vaccinated, we not only obviously prevent illness and in hospitalizations and deaths, but we prevent the possibility of new variants developing. So this is why we need a Manhattan Project in getting vaccine to the rest of the world, and we need a Marshall Plan to deliver it.
Hey,
Hey, doctor, it's Jonathan Lemire. Good morning. I just want to go back to something you just said about bubbling the children of the country, and that's a striking phrase. And I wanted to ask you two things about it. First, what can you tell us right now about the impact of the Delta variant? Like, are kids getting sicker with this particular variant than earlier strains of coronavirus, where it seemed like, with exceptions, children were largely unaffected? But then secondly, and importantly, are you recommending that this fall, as parents across the country are gearing up for the start of the school year again, that children should not be going back to school for in-person learning, even if they are, say, wearing masks and windows are open and other mitigation factors?
Well, first of all, the epidemiology of this virus in kids, in other words, the way that it's transmitted, who gets infected, how many people get infected, has really changed from the beginning of the pandemic. If we were sitting here having this conversation a year ago today, we would have said kids very rarely get infected, or if they do, they only rarely really get sick, and they almost never spread it to anyone else. When the Alpha variant emerged, that B117, last December and January in the United States, that began to change the situation in kids, and Delta has completely changed it. We are seeing widespread transmission to and by kids. And so many of the recommendations, even the CDC recommendation on school openings, are outdated and somewhat not helpful, because we now know that the Delta variant can, in fact, cause more illness in kids. Look at the number of reported outbreaks in summer camps that are occurring right now with this in kids. So I think this is something we surely have to take real concern about in terms of what it means for kids. Now, kids are still getting infected at a rate that's higher than last year, but we're not seeing large numbers of ill kids, meaning that that in the sense the rate of serious disease is still relatively low per 100 people getting infected as a child. But I think it's fair to say that at this point we need to think about the fall. What is this going to mean? What's going to happen with the rest of the summer? You know, we may see a major surge of cases this summer that could surely change how many people are infected and now recovered before school starts. But I think that kids are back on the table as an unknown in terms of this pandemic.
What's the risk at this point, Dr. Osterholm, in your eyes, of us sort of sliding back to where we were, I don't know, 6 months ago before the CDC issued its guidance saying, okay, it's safe to take off the mask now, certainly outdoors? We've seen Los Angeles County, which was doing well, put its mask mandate back in for indoor settings. Do you think we're at risk of seeing that nationally?
Well, I think one of the things, Willie, that's really important is we can't be lulled into a false sense of security. I can tell you, much of the last 3 months, very few people in the media wanted to deal with a bad news story about this and what was happening with Delta in other parts of the world and what it would mean when it came here. It was all about a celebration. You know, when 4th of July, we celebrated, you know, basically getting past COVID. I think people are now realizing that was premature consideration. And that even to the extent that some of the scientific experts on the media have been saying, well, this is going to be a seasonal disease, fall and winter. It's going to skip the summer. Well, look what it's doing right now. It's not skipping the summer. This virus is going to do what it's going to do. So I think on one hand, we have made major inroads with the level of vaccination we have in the United States. But again, I put that 100 million number out in front and say we still have a long ways to go. And so I think that the challenge is, you know, we can't let this virus freeze us into inaction and a lack of everyday life. At the same time, we have to understand it's not going to go away soon. And if you're in places right now, such as in the South, you actually are seeing the worst days of the pandemic to date. And I think by the time the summer's over with, we're going to see other parts of the country where this is going to happen too.
Dr. Michael Osterholm, thank you so much for being on this morning. We hope to see you again soon.